Welcome back. It's still Morning Rush on Metro Television, and we have Dr. SHERIF Okyeere, a health practitioner from Amen Scientific Herbal and Alternative Medical Hospital, and we are going to talk about breast cancer. Doc, good morning.
Good morning.
They say real men wear pink, and indeed, doctor is representing this morning. I mean, the camera and the lighting is not even doing justice to the level of pinkness. You didn't get.
I didn't get the memo that it was gonna, but it looks good in pink.
Yes, Doc, it's good to have you here again.
Yes, it's always a pleasure to be here.
Okay, breast cancer. I mean, over the years, since I started doing TV, every October, I mean, we talk about breast cancer.
Yeah.
And I will want to ask if the education, the importance of early detection, accessibility to the health facilities, and timely detection, is it being effective? Are people adhering to it? Are people hearing the education we are putting out there? Do they come?
Is it working?
Is it working?
Thank you so much, Sana. I think it's helping.
That's the word. It's helping.
Yes, it's helping because gone are the days that when you see women reporting to hospitals with breast cancer, and they are the late stages of the condition that nothing can be done about it. Because I remember, I think about 4 or 5 years ago, we had a case that both breasts was, in fact, it was today. In fact, the whole chest was, so to say, rotten.
Oh.
Because this issue of cancer and the fact that they have to do surgical intervention, I will go, I will not go. You know, I don't want them to take off my breast and all those things. And in fact, I had a picture. I think I have to look for it. It was that bad. You know, when they reported to the facility, the case was that bad. But, you know, looking down the line and the fact that every, October, it's assigned to health workers to educate the population on breasts and the importance of knowing the states of the breast and education about breast cancer, it has actually gone a long way to help, with a lot more of early detection. Yeah. Because now, when some of these conditions are detected early, it goes a long way to help with management and treatment. And even at some point, there are creative, treatment for people with early detection. So it is helping, but I feel there's still a lot more to be done in terms of education and all those things, because there are a lot of stigma still out there that, for example, if you're a woman and maybe due to breast cancer your breast has been taken off, it makes you less of a woman and all those things. So I think we still need to do more in terms of the education in breast cancer and some of the things that needs to be done when it comes to breast cancer.
Getting into the month of October, you see a lot of pictures, a lot of breast pictures on social media, especially with the guys.
Yes.
Some saying that, ladies, allow us to hold, allow us to suck it and all of that. As you're talking about the fact that it is helping, the role of the men, has it also, do you think that it has also really helped in that, or it's just the women who have always been interested in trying to find out about this particular problem?
Yes, I think men also plays important role in some of these things, because just as you mentioned, I think yesterday or from first I started seeing on my on WhatsApp status some of the guys like posting they are taking advantage of
for the fun of it,
the fact that it's in October, but it is very, very important. All these education, the fact that men would have to be touching their breasts, of their women, trying to, because they know it, they know how the breast looks like. So, for example, if you are touching and there are any differences in how they look, how even the appearance, but some of the signs that you see when it comes to breast cancer is changes of how the breast looks. You see a lot more of pigmentations around it. So what, the mere fact of taking your time to look at it gives you an idea on what is going on. Because if there are any changes, any color changes, any pigmentations on the breast that you are well versed with, you can easily identify it. For example, if you are holding it and the size has changed, it's more heavy. If you are seeing some nodules, some lump, some, in it, it is easy for you to identify. That is why it is very, very important for men to be involved in some of these education. And research has also shown that if you suck on the breast, it goes a long way to help, in some of these, in some of these situations. So
is it scientifically proven?
Yes, yes. So if you look at some of the causes or some of the risk, it is believed that women who probably have not used the breast, maybe in breastfeeding and all those things, their risks are higher.
Okay.
You understand? So it is scientifically proven that when you suck on the breast, it reduces your risk of getting breast cancer.
I was looking at the statistics here, and it says that globally, breast cancer is the leading cancer diagnosed across all ages and sexes. And approximately, there's 2.3 million of breast cancer cases in the world or globally. Now, in Africa or in Ghana, 19.5%, that is 1,147 cases of all newly diagnosed cancers in 2020 were breast cancer. Now, in that 3-year space, in that 3-year space from 2020 to this particular year, looking at the agencies, Ghana Health Service, all these breast cancer awareness groups, and even the women themselves, do you think that their preparation towards October has been like so good that it is yielding positive results, even with the young girls who are coming in?
I think, all these agencies are doing their best, but I still think, that is my personal opinion, that a lot more needs to be done. And I am also thinking that we need to also look beyond October. That it shouldn't just be October. The education should be going on to schools, to the markets, spaces. We need to educate the public more on breast cancer, because when you go to when you are in Accra and Kumasi and all those places, you don't see some of the importance of some of these education. But when you go to the hinterlands, to the villages and all those, some people don't even have access to television and radio. So they don't know. They don't get these information. So I think we need to do more of these education and even look beyond October. And it has to go down. The education has to go down, because when you look, in fact, when you've seen someone go through breast cancer and the suffer that they go through, you understand some of these things. It is not easy at all. So we need to educate the public more on breast cancer, because of the fact that if it's detected early, there are measures to help some of these situations, and there are things that we can even do to prevent the condition from coming in the first place. You understand? So we need to intensify the education, and we should all come together. We should all come together to help, get the education down to the people.
I mean, the whole month is for breast cancer, and every Wednesday we do have doc coming in. So in the subsequent weeks, we will talk about the causes, the prevention, which people get sick. But then let's focus on what Amen Scientific is doing in this October to also help create more awareness or help women in general.
Yes, so Amen Scientific Herbal and Alternative Medical Hospital as stakeholder in health delivery in the country. And in the month of October, what we are doing in all our branches across the country, about 18 branches. In the month of October, we are giving free breast screening to every woman that comes to Amen Scientific Herbal and Alternative Medical Hospital. And when you look at some of the diagnostic measures that we do when it comes to breast cancer, we talk about the examination that we do when you come to the hospital, the imaging and some tests. So we are doing the examination for free for every woman that comes to Amen Scientific Herbal and Alternative Medical Hospital. And with the imaging, that we can actually scan the breast to see what is going on and all those things. We are doing it at a 50% discount for every woman that comes. So we just want everybody to come and get checked. Even if you can't do the scan, just come for the examination to be done. There are a lot of things that the doctors will take their time to assess to see if there's any problem whatsoever. So just walk to Amen Scientific Herbal and Alternative Medical Hospital, any branch across the country, and you get yourself checked for the breast examination for free. And if you want us to do the scan, at a 50% discount for any woman that comes.
Well, on behalf of the women, our mothers, our sisters, our girlfriends, our wives, please, our husbands, boyfriends, uncles, aunties, whoever, brothers, please, this is the best gift you can give to any woman in your life. Make sure that you take them to Amen Scientific for them to get checked this month of October as we try to create the awareness on breast cancer. Very, very important. Over the years, we've had conversations with people who have survived breast cancer. They've shared their stories with us. And you know how harrowing or horrible the situation is for them, and they do not want anybody to get into that same space. And that's what we're trying to do. So make sure that you sponsor. I've seen my brother Nanayo Puku nodding his head, meaning that he will be doing that.
Some can also offer to accompany the women. Talking of accompanying the women, I guess some people will travel to Kumasi to actually accompany their women.
So I mean,
do the screening, but
that's the most important thing. So Doc, take us through the location.
Yes, Amen Scientific Herbal and Alternative Medical Hospital. We are all over Ghana, from Bolga to Wa to Tamale to Sunyane to Takrady to Ho, in Accra, Kumasi. In Accra here we have two branches, one at Domis, Senate Flats, and Lashibi Club close to the Ashama Underbridge. You can call Amen Scientific Herbal and Alternative Medical Hospital on the following numbers on the screen. Those who can see and they are hearing us, it's 0244 227 192 and 0207 229 505. And the last one is 0245 275 254.
I think over the years, most people go and then we just get the examination. But I feel this initiative where you guys have introduced the fact that you can actually scan to see if there's something there or something isn't there. I think everyone should take advantage of it. 50% discount.
50% discount.
I mean,
that works.
50% discount. You can manage. The gentleman. September salary is in. Just sponsor.
Sponsor them.
Yes. Doc, thank you very much.
Thank you so much for coming in this morning.